is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'll be talking to Shannon Meehan. She's an exercise physiologist with NMC's Cardiac Rehabilitation Service, and Wendy Lawrence, a physical therapist with Northwestern Orthopaedic and Rehabilitation Center. So we're going to be talking about how exercise is medicine, it sounds like. Yes. So that's terrific. So welcome to you both. So thank you for being on the show.
Thank you for having us.
Thank you.
So we are definitely going to be talking about exercise and how important it is for our health. But first and foremost, let's tell our viewers who you are and maybe a little bit about your background and experience.
I'll start, I guess. So,
perfect.
My name is Shannon Meehan. I moved to Vermont 7 years ago. I have a background in strength and conditioning as well as exercise physiology. I've been at NMC for about a year and a half. I originally started with Dr. Beatty in orthopedics, and now I've transitioned to cardiac and pulmonary rehab.
That's fantastic.
Yes.
That's exciting. So many different opportunities, right?
Absolutely.
That you can learn and grow at the hospital.
Absolutely.
And I'm Wendy Lawrence. I'm a physical therapist. I've been at NMC for 28 years and have done a variety of things. My specialty areas at this point are pulmonary rehab, lymphedema, and oncology rehab, as well as providing general PT for orthopedic, mostly orthopedic related conditions.
Did you recently get an award?
I did get an award recently.
So tell us about that so we can celebrate you right on the whole public, the whole public show here.
So I got an award for excellence in clinical learning. So that recognized my commitment to lifelong learning, and I have done a lot of specialty training, and medicine is not a static thing. It's really a dynamic thing, and there's continuous learning to kind of stay abreast of what is up to date and evidence-based.
Well, well-deserved.
Thank you.
Congratulations.
Thank you.
It's terrific. It's terrific. So Shannon, you said you're new to the hospital, about a year and a half. So what brought you to Northwestern Medical Center?
Well, I've heard very, very good things about, the community and just how community-oriented Northwestern Medical Center is. And when I first interviewed here, I just found that it was such a kind and welcoming atmosphere. Everyone is just very kind here. And so when I originally looked into working here, that's what really sparked my interest, was the community-based healthcare. So
fantastic.
Yes.
Well, great.
Thank
you.
you.
That you've joined us.
Thank you.
So we're going to be talking about exercise and how it's encouraged at NMC. So maybe we should start off by talking about physical therapy and what it is and then where you receive that at the hospital too. So just to orient viewers where you're located, as well as what is physical therapy, and then we'll start talking about specialized stuff in a minute.
So we have multiple sites where we provide physical therapy. On the hospital campus, we provide outpatient services from the Cobblestone building, and that's also where the cardiac and the pulmonary rehab meet.
Okay.
We also have acute care services at the hospital itself. We have satellite PT clinics in Enosburg, Georgia, and at Brannan's Pool in St. Albans.
Great, thank you.
So we really have services that cover the whole geographic area of Franklin County.
That's great. Access is so important. So the gym space at Cobblestone, that's been recently renovated. So what's that entailed?
Well, basically, they opened up the whole downstairs of Cobblestone into a large gym and brought the cardiac and pulmonary rehab downstairs, as well as the oncology rehab. And so it's just this very large integrated gym where we're all working together and hopefully providing a nice continuity of care. We see people for outpatient services, and then Shannon sees people in cardiac rehab for phase 2 cardiac rehab, but when they're done that, we have a phase 3 program, which is basically a medically supervised maintenance program, so that people who want to continue exercising can do so in the same gym where they did their rehabilitation. And have some of the same familiar faces.
Absolutely, absolutely. So what's been the benefit to having this more open concept for the patients? What are you seeing? Especially because you've been upstairs.
Exactly.
So now you're downstairs,
Right.
so you're all, so what have you seen as a difference?
I mean, I've really seen that there's more eyes on patients in general, but I think a big part of cardiac rehab is not just the physical rehabilitation aspect, but the mental. So I think it's very important for people socially to be all together and in an open concept. And we've had very great feedback thus far. So
Excellent.
yes, for sure.
So let's talk about cardiac rehab and
Sure.
pulmonary rehab.
Yes.
So what does your work entail, and why do you have to have cardiac rehab, those types of things?
Sure. So phase 1 cardiac rehab is usually inpatient in a hospital. And then they'll be referred, usually by UVM, to phase 2, which is now downstairs. And that involves every patient being monitored on telemetry. So Katie Magnuson, she's the nurse that I work with, her and I will be watching a computer screen with everyone's telemetry on it. And you're watching people's heart rates and making sure everything looks okay. And we basically prescribe exercise as medicine. So yeah.
For life.
So, exactly. So that's a 12-week program, 3 days a week they come in phase 2. And it's incredible. I mean, I haven't been down there for very long, but to see the gains that people make physically, mentally, socially, even on like the nutrition aspect, and it's incredible. So after they're done with phase 2, they'll graduate into hopefully phase 3, which again they're in that social setting with people who've gone through similar, had a heart attack or anything, any heart-related issue. So it's very, I believe, comforting for them in phase 3.
Yeah.
So. Yeah, it's amazing to see, how everyone does. But basically, we're prescribing exercise as medication, as simple as I can put it. So
That's fantastic.
yes,
No, you're both involved in pulmonary rehab too?
Yes. Correct.
So how does that synergy work between physical therapy and exercise physiology?
Well, the pulmonary rehab is similar to the cardiac rehab. We're not monitoring telemetry, but there's a phase 1 where I see them in physical therapy, one-on-one, and do an evaluation of somebody's strength, their balance, anything else, their breathing patterns, things like that. And then work with them one-on-one for a few sessions in terms of working on their breathing mechanics and being able to coordinate that breathing with activity, because a lot of these people, are very, very short of breath, and that's very anxiety provoking. And then as you get more anxious, you get more short of breath. And so working with them on some strategies to better control their breathing, and then to begin to coordinate that with exercise, because the other thing is that when people are really short of breath, they're not very physically active, and so there's a lot of deconditioning that occurs. And so really working with them, again, exercise as medicine, but trying to work with them with their breathing mechanics and making them a little bit more efficient. They're able to do more activity with less shortness of breath. So similar in a lot of ways to the cardiac rehab, but a little bit different in terms of
And
how
so you're also
monitoring
involved
people.
in the pulmonary
correct.
piece as well?
Yes.
Is your
I
role
am.
different, or do you guys work together?
We work together. Yes,
work together.
It's a very team-oriented approach.
Right. And we're just transitioning to Shannon running the phase 2 group. So I'm seeing that, I will be seeing them in physical therapy and one-on-one, and then making that transition to Shannon. And there's an athletic trainer who is working with her as well. And so she's going to be doing the phase 2 group, but again, it's very collaborative between the two of us.
And so is this supervised, their cardiac and pulmonary rehab?
Yes.
Would you call that
Both.
supervised
Yes.
sessions? Okay.
Yes.
So people can feel comforted that someone is keeping track of them.
Right, so
and
we're
helping them.
monitoring vital signs. We're, in the case of pulmonary, we're monitoring their oxygen saturation,
Great.
making sure that their numbers are where they should be.
As well as cardiac rehab, we're monitoring not only their telemetry, but their vitals as well, their O2 set if they have any issues breathing. So we're constantly keeping an eye. Also, cross-room triaging, just to keep an eye on people. Are they looking okay? Is their color okay? So
Nice.
a lot of that as well.
Great.
Yes.
Super. Now, what about exercise as medicine for patients recovering from cancer?
So we have a oncology rehab program where it's similar to what I'm doing with pulmonary in that I do a physical therapy evaluation, and then sometimes there are some skilled PT needs where I might continue to see someone one-on-one. But again, there's just this huge element of deconditioning. There are lots of side effects to all of the treatments that people have been through, their surgery, their radiation, the chemotherapy. So people may present with muscle weakness, they may present with balance problems, they may present with neuropathy in their hands or feet where they can't feel their hands or feet as well. And so we can work on all of those things in terms of getting them to a point where hopefully they can join the cancer rehab exercise group, which meets twice a week and is free for the first 8 weeks, so 16 visits.
Wow.
And to keep those people exercising and building up that strength. Typically people get to the end of a year or more of treatment, and they're kind of given the blessing by the doctor of, okay, you're, and they're like, but why am I feeling, so bad? And it's because they're weak, they're deconditioned, they, and many of the treatments take a toll on a lot of different body systems. So it really helps, and it's been very rewarding to work with that population and see. There was one lady I had who, was so weak she couldn't even turn the key in her car. And her doctor kept trying to get her to come to PT, and she kept going, no, I don't want to go to PT. And finally, when she couldn't turn the key in her car, she came to PT, and she did extremely well. And so it's very rewarding to help them with their quality of life after a cancer diagnosis.
That's terrific. Well, I can feel your passion about helping people become their best self and getting exercise back in their lives. So thank you for your work for that. So that's very busy. So as you give so much to your patients, how do you take care of yourself and make sure that exercise is your medicine as well? So how do you do that for yourself?
Well, for me, exercise is also a good stress release.
It is,
in addition to the physical aspects of exercise. So I do try to do a combination of things. Some of my favorite things to do are yoga, bike riding. Particularly, my favorite ride is on the Colchester Causeway.
Yes,
this time
that
of
is
year, and it
beautiful.
just reopened. Hiking. Walking my dog, working in the garden. So,
Great.
I am very physically
Stay
active.
active.
Boy, I have a very similar answer.
Do you?
So I love yoga, love lifting weights, going for walks. Really being in nature is a huge stress reliever for me. I have a dog, Scout, and he and I go for walks, and just being outdoors and spending time with family and friends as much as I can is big. So
That's terrific.
Yes.
Well, thanks for practicing what you're preaching.
Sure.
Right? Exercise is medicine. Well, our time is up, But thank you both very much for talking about cardiac, pulmonary, and also care for cancer patients as well. I know there's much more that you do, and so that means you're only going to need to come back and talk about all those other great things that you do. But thank you so much for caring for our patients and getting exercise back in their lives.
Thank you.
Thank you.
Yeah. I'm Jill Bowen, CEO of Northwestern Medical Center, your host of the Health Beat Show. And it's been fantastic to hear about how we can put exercise back in our lives and live healthy and happy. And thanks for your support. Thanks for joining us.